Welcome to part 2 with Lisa DeCandia on women's health. We talked a bit on homeopathy, the first part, and treating children with it. So now we're going to change gears. So Lisa, thank you for talking with me today.
My pleasure.
How does homeopathy help prepare for pregnancy, assist in labor, and delivery? A lot of my friends will want to hear this.
Oh yeah?
Oh yeah.
Oh, good. Well, as I said in part 1, homeopathy is, let's call it an immune booster. So naturally, it can help a pregnant woman rebalance herself, make her stronger, healthier during the pregnancy, which ultimately then leads to a better outcome in terms of labor and delivery. And it can also be beneficial and I know we're going to talk about this a little bit later, but it can be beneficial in treating pregnancy-related issues such as morning sickness, which we don't call it morning sickness anymore because a lot of women get it throughout the day. So pregnancy-related nausea, let's call it that. Homeopathy can also be very helpful during labor and delivery. And it can help avoid or reduce medical interventions and allow a woman to be able to deliver naturally. Ooh. And recover very quickly. And I'm here to attest to that because I was treated homeopathically during pregnancy, labor, and delivery, and natural birth, no interventions, very quick recovery.
Okay, I got to interrupt and ask you, can it replace epidural?
In some situations it can. Don't get me wrong, those interventions, if you need them and the woman wants them, it's great that they're there. Mm-hmm. And they don't call it labor for nothing. It is work. However, if you are going through and the best time of treatment really is before you get pregnant, if that's possible, if it's possible. But it's amazing what homeopathic medicines can do during labor, delivery, and afterwards, and help a woman heal better. So it can possibly replace an epidural.
Wow! And she will have a lot of knocks on her door now. So how important do you think it is to have a homeopath to be part of the team assisting in labor and delivery?
Well, I'm going to say very important, obviously. But many pregnant women may choose to take like a pregnancy homeopathic kit with them to their labor and delivery, help their birthing partner or their partner, or to administer the homeopathic medicines. Many midwives carry a homeopathic toolkit. Yeah,
I've heard. Yeah.
Yes, so they find it beneficial. So women, if they choose, they can have homeopathy during labor and delivery.
Now, with pregnancy comes the various concerns of making sure it's a healthy baby.
Of course.
And I'm assuming it's primarily dependent on the mother's health. So in your practice, have you come across situations where the baby's health was at risk? And if so, how did you address it?
Well, sometimes something like the position of babe, we'll talk about that. So for example, if babe is breech or posterior, it can be a concern to mom, especially if she wants to have a natural delivery. She doesn't want interventions, or a C-section. So in terms of position, sometimes, again, I'll go back to that, interventions may be necessary. However, with good, consistent homeopathic treatment, position of babe can be set, everything can be rebalanced so that, again, we reduce the need for interventions if possible. And ultimately, then the less interventions, the healthier babe is.
Right. Yeah. Okay, so doing that at home would be ideal.
It can be, again, if everyone's on board, then that would be great, and the woman has the proper support.
Now, when you're treating, and you didn't mention this before, when you're treating a woman for symptoms of pregnancy like nausea or
Mhm.
pregnancy-related
Nausea.
does that affect the child?
So I'm going to give you the short answer. No.
Okay.
I have not seen this. I've treated many women with pregnancy-related issues, nausea, varicose veins, hemorrhoids, for example, and I've only seen positive effect during pregnancy and afterwards with Babe.
Okay, that's really good.
Yeah,
Even for serious conditions.
Yeah, it's great.
Okay.
Now, for serious conditions, again, depending how serious the nausea is, we have to make sure that we keep watching it. For things like gestational diabetes, they're definitely going to be in touch with their doctor. That's a must. But homeopathy, again, can support them and in the long run give them a healthier and happier pregnancy.
Can I just throw another question in there related to that?
Sure.
If a woman has, say, she's being treated for chronic situations and she's on prescriptions, and then you throw homeopathy in the mix, does that affect the baby?
During pregnancy?
Right.
You're talking during pregnancy? Well, first thing is that the woman will have checked all of the prescription medications out with her doctor. So I leave that up to her and her GP to make sure that everything's fine and it doesn't affect Babe. And again, we go back to homeopathic medicines. Don't contraindicate prescriptions.
Right.
So again, totally safe for mom and Babe. That's why a lot of women come to homeopathy when they're pregnant, because let's say they do have pregnancy-related nausea, for example, and they don't want to go on a prescription because they are concerned about a side effect to Babe. Homeopathy is a fabulous alternative in that case, and very effective.
Okay, very useful information. Do you have any last few words or advice for expecting mothers interested in learning more about alternative healthcare?
I guess as with any healthcare, do the research. There's a lot out there. So research, talk to practitioners if you can. I think that's important. And once you have done the research and you find something that really sort of resonates or works for you, then choose that. Because when you choose something that you really feel good about, it's going to be good for you and it's going to be ultimately good for Babe.
Thank you so much.
My pleasure.
And that was part 2 of Lisa DeCandia.